Good morning. Do you have problems when you giggle, that you dribble, or you got to squeeze real hard before you sneeze? We have gotten so many requests to go back over urinary incontinence and pelvic floor disorders. I thought I would go back with you over that. And some of the questions came in, well, you told me about it, but how can we fix it? So we're going to try to cover all that today as we talk about urinary incontinence, pelvic floor disorders, and ways that we can help women not have to wear their Depends all the time or their pads, which can be quite irritating. First of all, there's stress incontinence. Now, this is the typical, you giggle, you sneeze, you laugh real hard, you try to jump on the trampoline with the kids or grandkids, and you leak. And this comes from the fact that the urethra, which is what you urinate through, is short in women. And most commonly because of childbirth, but there are other causes as well, the tissues that support that urethra are weakened. And whenever you cough or sneeze or laugh, the urethra wiggles. And when it does, that causes a little bit of leaking. This can gradually get worse over time, which is typically the scenario, is that it gradually gets worse over time, and then the leaking gets worse as you go along. There's simple ways of correcting this. There are two major ways when it's pure stress incontinence. One is what is known as the urethral sling. If I can demonstrate it, this is your bladder and this is your urethra. When you laugh, sneeze, or whatever, it wiggles and moves, and that causes you to leak because it is kind of a short structure. With a sling, it sits right underneath the urethra so that the urethra is held in place. It's kind of like a hammock is what I refer to it as. So when you cough and sneeze, etc., the urethra, instead of wiggling, just sits like it's supposed to. The nice thing about this is an outpatient procedure, very minor, in and out same day, back to your normal activities in no time. Another option is to inject around this urethra some bulking agent to tighten up that sphincter so that you don't leak. This too is a very simple outpatient procedure that's done and has a very, very good success rate as well. So there's lots that we can do for pure stress incontinence. Then you start getting into aspects of other types of incontinence, which may be from overactive bladder, where the muscle in the bladder, the pelvic structures are very sensitive. They go into spasm real easily. And when that happens, when you get that urge to go, you better go in a hurry or you're going to leak. A lot of times that can be treated with medications. If they don't respond to medications, there's other things that we can do to help relieve that urgency and that incontinence, where you're either feeling like you got to go all the time, or you have a situation where when you do have to go, you better get there real fast. A lot of times women are waking up anywhere from 1, 2, 4, 5 times a night to have to go to urinate. Well, not only is that an aggravation, but it also interrupts your sleep cycle. And we know that getting a good night's rest is very important for a lot of health aspects. So please remember that if you're getting up several times at night, if there's something we can do to correct that, then it is important, because then you can get a good night's sleep and your body can rest and restore itself like it's supposed to when you sleep. There are other causes of incontinence, which may be from overfilled bladders that do not empty completely. And ladies, I can tell you right now that situation where you either can't find a clean restroom or you're too busy to go to empty your bladder, and you're getting that urge and you can hold it a little bit longer. And I give you credit, you have good control over that in most cases. But over the long term, what ends up happening is that your bladder is weakened, the muscle is weakened, you don't empty like you're supposed to. And that can eventually lead to that muscle becoming oversensitive so that you tend to leak. But also, if you've got a full bladder, it's real hard not to leak when certain things like coughing or sneezing occur. Coupled with that in pelvic floor disorders is the symptomatic rectocele. So many women think they have constipation problems. Now, constipation is where you just don't go. You don't have the urge to go. There's nothing happens. But so many women have a situation where, hey, I feel it sitting there. It's just getting it started is very difficult. Or both is after I go, I get up and 15, 20 minutes later, I got to go again. Well, that comes from the fact that the tissues between the vagina and the rectum are real weak. And whenever you strain to have a bowel movement, everything balloons up into the vagina, and that causes you not to be able to empty well. A lot of ladies tell me I have to rock on the toilet or I have to lean forward. There's some say I have to reach in and push on the bottom of my vagina to get it started. Others say, well, once I do get it started, I go. Then 15, 20 minutes later, it seems like I got to go again, and there's still more stool. You got up and moved, and everything shifted a little bit, and what had been caught up in a pouch pushed up into the vagina now is ready to be evacuated. So please understand there's lots that can be done to fix this. The most common is a rectocele repair, which again is a simple outpatient procedure that has almost instantaneous relief, which is very, very important to a lot of ladies. I see some questions coming in, so give me just a minute. Beatrice, no, Beatrice, you do not have to have a referral to come in and be evaluated for any of these problems. If you do have one, that's perfectly fine, but that's not a requirement. You can call the office at 843-572-7123 and just tell the receptionist I have a problem with urinary incontinence or difficulty having a bowel movement. I'd like to be evaluated, and they can set you up an appointment so that we can see what's going on and what can be done to help you. So no, a referral is not required. We welcome all patients that feel like they have a problem and want to be seen. Okay, let's see here. Miriam. Okay, Miriam, no, you do not have to drop the current doctor that you have. We don't require that either. A lot of ladies come in, get their problem fixed. They can go right back to their primary care doctor or their general practitioner or whoever to continue their annual checkups and pap smears, etc. We don't require that someone switch doctors and be seen in our office. Of course, we're open to anyone who needs a new physician in the field of women's pelvic health to join us, but that's certainly not a requirement. So, ladies, don't sit around suffering for things that you can do something very simply about. We're here to help you, to be there when you need us, and we will certainly advise you of all the options available, where this can be helpful to you, and what the overall results will be. So thank you for joining us today. We certainly enjoy the opportunity of sharing with you, and I look forward to talking to you again. Coming up in the future is going to be talking about menopause and hormone replacement, and there are huge advances that have been made in this aspect of medicine. So thank you. Hope you all have a great day and a good week.